Hi, my name's John, I'm from Outcomes Fitness, and today we'll be talking to you about a few exercises that you can use to treat back pain. So there's a number of different types of back pain. A lot of them tend to go undiagnosed, or just known as non-specific back pain, but today we'll be looking at a few which are a bit easy to diagnose, and that way it makes it a bit easier to develop some exercises that can help try and improve that pain. So it's important to remember that with any type of back pain, if you are feeling any other symptoms such as numbness, tingling or pain running down either of your legs, it's important to check with a medical professional such as a physiotherapist just to get clearance before you start exercise. But if you are feeling just some niggling pain or want to prevent back pain from occurring or from reoccurring, then here are some really good exercises to try and use. So there's two really common types of back pain that we're going to be looking at today. So the first one is a type that occurs commonly when doing bent over or flexion exercises. So it's really common when people are bending over and picking up objects from the floor. They can often get some pain developing in that lower back area. So this is often caused by pressure caused by the intervertebral discs on the back of the spine. So when the discs tend to decrease in pressure on the front, it causes a bit more pressure of the discs to go towards the back, near where the spinal nerves are. So that can cause pain there. So a really good way to try and reduce those exercises is to do the opposite of this movement. So instead of doing flexion, we go into extension. So a really simple exercise to try is just get your hands placed on your back, so just above your hip bones. Your fingers just either side of the spine, thumbs resting around the side. Then you just set yourself up to just extend that back out. Think about really keeping those hips nice and stable. So it's important with this exercise to make sure that that movement is nice and smooth, so you get that extension going out. Think about almost extending each vertebrae itself at a time. So you're holding that extension for about 15 to 20 seconds. Okay, so the next one's a slightly more advanced exercise. This one we're doing from your front. You're setting up on your elbows and hands. So I'll show you this one. So it's important to stay nice and low. And using this mat to get that feedback to get those hips on the floor. So you stay down nice and low, and similar to the last exercise, you try and make sure it's a really smooth extension movement. And again, you're trying to hold that one for 15 to 20 seconds. So it's important for these exercises, you're trying to do them at least 3 times a week, and specifically when back pain is occurring. So the next type of back pain we're going to look at is almost the opposite of that one. It's one that's actually relieved when sitting down and can sometimes cause pain when standing or walking or lying in specific postures. So this one's often caused by the joints towards the back of the spine, known as the facet joints. When they become a little bit too close, the pressure on those causes them to often rub against each other, cause inflammation and tenderness. So a good way to reduce that is again to do the opposite. So this one could often be caused by the pressure going backwards, so it's good to do the opposite movement coming forwards. Another really common cause is tightness in, say, the glutes and the hamstrings. So the first one exercise I'll show you today is just a stretch on that. So you start just by lying on your back. You should be bringing your knee in towards your chest. So just grabbing on there, pulling in nice and close, until you really feel a good stretch coming down those hamstring and glute there. So if you're feeling it in any other areas, just check to make sure that you bring your knees straight back and not going out to the side too much, coming in too narrow. And again, you're just holding that one between 15 to 20 seconds. Okay. So the next one I'll show you is a slightly more advanced version as a roll up. So this one, think about hugging your knees really close into your chest, keeping your eyes focused on your waist, your chin tucked in. You're just rolling yourself out and back, using momentum to bring yourself up and down. So this is a really good one to get that length going through that spine. So I'll give you an example of that one. So again, you're just using that momentum to bring yourself up. So those are some really basic exercises you can use to decrease that pain. When you do find that that pain has decreased, and you want a slightly more advanced way to stop that pain from occurring, some really good movements to try is Pilates style movements, because those really work at building that core strength and using that strength as a buffer to keep that spine really protected and nice and strong. So you can see some videos and some examples of those exercises on our YouTube channel, Outcomes Fitness, or try our website, outcomesfitness.com.au. Thanks for watching.